Hi, my name is Nick Pratap, and I'm a clinical exercise physiologist here at the PCSC program. You're about to start the advanced version of the exercise set for bone metastases patients. Only perform this program if you've successfully completed both the beginner and intermediate versions of this exercise set. Continue to monitor for pain both during and after the exercise set. If you do notice an increase in pain, please speak with your clinical exercise physiologist.
Squat, arms forward. Stand with good posture, feet shoulder width apart. Hold arms out in front of your body at shoulder height. You can also have your arms across your chest. Initiate the squat by bending at the hip. Begin to lower your body. Squat as low as you can under control. If you feel pain in your knee, squat to right before the pain is felt. Rise up by squeezing your glutes and pushing through your feet to return to the starting position. Push up. Keep shoulders pulled slightly down and together. Lift your body up onto your toes and begin with your arms fully extended. Lower your body toward the ground. Stop when your elbows get to 90 degrees or your chest is about 5 centimeters from the ground. Return to the starting position by pushing through your arms. If this is challenging for you, try performing the push-ups off your knees and progress to push-ups off your toes. Repeat for the required repetitions. Shoulder Y, wall. Stand with both arms up in a Y position. Slide your forearms up the wall using your shoulder blades, then lift your forearms off the wall. Slowly lower your arms to the start position. Repeat for the required repetitions. Reverse lunge. Stand with good posture. To start, lunge backwards, keeping your back knee in line with your hip and shoulder. Lower down to a quarter lunge position. As you feel more comfortable, gradually progress to lowering down further until you are able to lunge with a 90-degree bend in the front knee. Only progress to this point if you do not experience knee pain. Return to the starting position and alternate the leg you step back with. Keep your front knee aligned with your middle toe. If you experience any knee pain, lower down to the point right before the pain is felt, and return to the starting position. If needed, feel free to have a chair beside you to hold on to for support. Repeat for the required repetitions. Dead bug, shoulder flexion plus hip extension. Lie flat on your back. Contract your deep core by pulling your navel in towards your spine. Continue breathing normally. Raise knees up. Raise arms straight in front of you. Lower arm and opposite leg down towards the floor. Return to the starting position and repeat with the opposite limbs. If you find this exercise too challenging, you can simplify it by raising your arms straight up. Your arms stay fixed in this position. Extend one leg straight out and return to the starting position. And extend your opposite leg out and return to the starting position. You can also keep your arms resting beside you with your palms down to make it less challenging. Bridge, single leg. Lie flat on your back with your arms laying flat next to you. Bend one knee with your foot flat. Lift your hips up by pushing through your foot to make a bridge using only one leg. When your hips are fully elevated, your knees, hips, and shoulders should be aligned. Do not arch your low back. Lower down in a controlled manner and repeat for the required repetitions. Repeat with the opposite foot on the ground. Repeat for the required repetitions. Elevated front plank, forearms. Position yourself in the plank position. Keep your shoulders, hips, knees, and feet aligned in a straight line. Contract your deep core by pulling your navel in towards your spine. Continue breathing normally. Keep your shoulders pulled slightly down and together. Slightly contract your glutes. Do not allow your hips to drop. Gradually add more time to the hold position as you progress. Hold the position for the designated time. If this progression is too challenging, you can perform the same exercise off your knees. Superman, arm plus leg lift. Be sure not to lift all limbs off the ground at once. If you experience any pain in your lower back, shoulders, or hips with this exercise, do not perform. Lay on your stomach, arms above head. Lift one arm and the opposite leg, lower down, and lift the opposite arm and leg. Repeat for the required repetitions. Four-point arm and leg raise. Start on hands and knees, hips and shoulders at 90 degrees. Contract your deep core by pulling your navel in towards your spine. Continue breathing normally. Lift one arm straight out in front. At the same time, extend the opposite leg straight back. Keep your hips square with the ground. Return to the starting position, then extend the opposite arm and leg. Repeat for the required repetitions.
Congratulations, you've successfully completed this exercise set. Feel free to perform this routine another 2 to 3 times during the week. If you have any questions, please bring them up with your clinical exercise physiologist.